Welcome to our deep dive into child and adolescent psychopharmacology. We've got a lot of articles and research here, and we're going to try to break down this really complex topic for you.
Yeah, it is a very nuanced field, that's for sure. We're talking about developing minds, so the stakes are high.
Absolutely. And one of the things that jumped out at me right away was how different this is from treating adults. It's not as simple as just adjusting dosages. It's like a whole other ballgame.
You got it. Children's brains and bodies are still developing, so, they metabolize meds differently. And we just don't have a lot of long-term data on the effects these drugs have on young people.
Right. So where do we even start with something as complex as informed consent? Like, it's usually the parents making the call, but how much say should the child have? Especially when it comes to taking medication.
Well, I think open communication is really key here. We need to understand parents' concerns, anxieties about addiction or side effects, things like that. But we also have to make sure the child's voice is heard, that they feel respected. It's a tough balance.
It is. The research we've got points to several conditions where early intervention is really important, not just to manage symptoms, but maybe even to protect the developing brain bipolar disorder, ADHD, schizophrenia, recurring depression, and even PTSD. That's a heavy list.
Yeah, it is. And the idea is that early intervention might not only help with the immediate suffering, but could also, influence how the brain develops during these crucial periods.
Makes sense. Okay, let's dive into a specific condition, ADHD. Many people still think it's just kids being hyperactive, but it's way more nuanced than that, right?
Oh, absolutely. ADHD can impact attention, motivation, emotional regulation. It's not just fidgeting in your seat. And getting that diagnosis right is so important because you can see ADHD-like symptoms in other conditions like anxiety or even, early sign of bipolar disorder. We don't want to be treating the wrong thing.
And it seems like misdiagnosis is a real concern here, right? Which leads us to the big question surrounding ADHD. Stimulants, they're the most common treatment, but there's a ton of controversy around them.
There is, and understandably so. We're talking about giving powerful medications to children, so of course people are concerned. But we also have to look at the science, right? Studies are showing that response rates to stimulants can be as high as 70% for managing ADHD symptoms.
Wow, 70%, that's a lot. But what about side effects? We're talking sleep disruption, appetite changes, stomach issues, mood swings. That's a lot for a young person to handle.
It is, and that's why it's not just about prescribing med, it's about finding the right approach for each individual child, starting with immediate release formulations, monitoring side effects closely, and then maybe if those are tolerated well, you could explore extended release options. It's a process, not a quick fix.
Sounds like finding that balance is key. And this is where it gets interesting for me. The chapter suggests there's a possibility that using stimulants appropriately for ADHD could actually be neuroprotective. Did I read that right?
You did. It's still an area of research, but the evidence is pointing in that direction. There's this study by Castellanos and his colleagues, and they found that children with ADHD who weren't on stimulants actually had smaller white matter volumes in their brains compared to both the control groups and kids with ADHD who were taking stimulants.
Hold on, smaller white matter volumes. Can you break that down for our listeners who might not know what that means and why it matters?
Sure. White matter is basically the communication network in the brain. It's all those nerve fibers that connect different regions and let them talk to each other. Smaller white matter volumes could mean less efficient communication, which could affect things like learning, attention, even emotional regulation.
So theoretically, stimulants, along with therapy, of course, might actually support healthy brain development in kids with ADHD.
That's the idea. But it's super important to say this doesn't mean stimulants are a cure-all or that every kid with ADHD should be on them. It's all about careful evaluation, talking openly with families, and weighing those benefits and risks for each kid, case by case.
For sure. Now let's switch gears to another condition that's often misunderstood, especially in young people. Depression, it can be really hard to spot because it presents so differently than in adults.
It does. While sadness is a big part of depression in adults, it's not always the main symptom in kids and teens. Irritability, anger outbursts, what we call anhedonia, that's losing pleasure in things they used to enjoy, are often more obvious signs. You might see them withdrawing from activities, complaining about physical symptoms, struggling in school. We have to look deeper.
The chapter mentioned that the standard way we diagnose major depression in adults actually missed a huge number of kids who were clinically judged to be depressed. Like 76% missed. That's a massive gap.
It is. So clinicians are increasingly using revised criteria that focus on things like irritable mood, anhedonia, sleep problems, fatigue, feelings of worthlessness, and trouble concentrating when they're assessing kids for depression.
So it's not just asking, are you sad? It's about looking at the whole picture.
You got it. And of course, when we talk about depression, we can't avoid talking about antidepressants and the whole debate about suicidality in young people.
This is a tough one. What does the research say about the risks and benefits of antidepressants for this age group?
Well, the chapter goes into the FDA's black box warnings. They were put in place to highlight the potential for increased suicidal thoughts and behaviors in some young people taking antidepressants. And while the overall statistical risk might be small, it's still something clinicians and parents need to be super careful about. We have to keep an eye out for any signs of worsening mood or suicidal thoughts and talk openly with the child and the family about these risks.
So it's about being proactive and not just assuming medication will solve everything?
Exactly. But here's where it gets tricky. Some studies have shown that in areas where antidepressant use is more common, suicide rates among teens have actually gone down.
Really, that seems kind of counterintuitive given the worries about increased suicidality.
Right, but correlation doesn't equal causation. There could be a lot of other things going on. The big takeaway here is that untreated depression is very dangerous, but so is medicating without careful thought, monitoring, and therapy to support it.
So it's about finding that balance again, that individual approach that takes everything into account.
Exactly, and it's a journey, not a quick fix. It takes time to find the right meds, the right dose, the right mix of meds and therapy. Plus, we have to remember that placebo responses can be high in kids, which makes things even more complicated. We're looking for long-term solutions, not just putting a Band-Aid on the problem.
Okay, let's move on to another complex area. Bipolar disorder. Traditionally, it's been seen as something adults get, but there's growing discussion about it showing up in childhood. How do we even begin to separate these diagnoses, especially with the overlap with ADHD?
That is the million-dollar question, and it's a tough one. The chapter highlights some key differences to watch for when you're trying to figure out if it's ADHD or bipolar disorder in a child. For example, things like irritability, inattention, hyperactivity, even pressured speech can be present in both.
Right, but how can you tell which is which?
Well, with ADHD, those symptoms tend to be, chronic. They're there all the time, not episodic. But with bipolar disorder, you're more likely to see those distinct mood episodes, periods of intense mania or depression that come and go.
So it's not just about the symptoms themselves, it's about the pattern they follow.
Exactly. The chapter also points out some red flags that are much more common with bipolar disorder, like needing less sleep without feeling tired during the day, those really long and intense rage episodes, hypersexuality, and even psychotic symptoms.
Those sound pretty scary, especially in a child.
They can be. And if there's a family history of bipolar disorder or related things like, suicide, substance abuse, or hyperthymia, that can also increase the chances of a bipolar diagnosis.
So if a kid is misdiagnosed with ADHD and given stimulants, could that make their bipolar symptoms worse?
That's the worry. The chapter suggests that stimulants might make those manic symptoms more intense and even make them switch between moods faster. That's why a thorough evaluation is crucial, especially if there's any suspicion of bipolar disorder.
It feels like getting the diagnosis right is half the battle in this field.
It really is. It's not just checking off symptoms on a list. It's about seeing the big picture, understanding the child's history, family background, how they've developed, and that's where a qualified mental health professional is really important.
So you can't really diagnose this in a quick visit to the pediatrician?
Probably not. While pediatricians are important for those initial screenings and referrals, the chapter is really pushing for kids with complex mental health needs to be evaluated and treated by specialists, like child and adolescent psychiatrists.
That makes sense. So it's a team effort between primary care and mental health specialists.
Exactly. And it's not just about medication either. The chapter keeps stressing how important psychotherapy is. Alongside any medication, meds can help with symptom, but therapy provides the support, coping skills, and strategies to really help these kids navigate the challenges they're facing.
Sounds like we're seeing a theme here, a holistic approach that addresses both the biological and psychological sides of these conditions.
Definitely. It's about addressing the underlying emotional and behavioral issues that often contribute to and make mental health conditions worse. It's about teaching kids how to handle stress, manage their emotions, and build resilience. Medication can be a helpful tool, but it's just one piece of the puzzle.
It's interesting how much emphasis there is on the potential for misdiagnosis, especially with ADHD and bipolar disorder. It seems like a really tough area to get right.
Oh, it is. And the consequences of getting it wrong can be, pretty significant, as we've been talking about. The chapter actually has this helpful table that lays out some of the key differences to look for.
Oh, that's cool. Does it go beyond what we've already touched on, like those distinct mood episodes versus, chronic symptoms?
It does, yeah. It goes into some more subtle distinctions. For instance, both conditions can have impulsivity, but the type of impulsivity can be quite different.
Can you explain that a bit more?
Sure. So with ADHD, impulsivity often looks like, trouble waiting their turn, interrupting others, acting without thinking things through. It's more about a lack of inhibitory control.
And what about with bipolar disorder?
Well, in bipolar, the impulsivity is often driven by grandiosity, a sense of invincibility, or just bad judgment during manic episodes. Think risky behaviors, spending sprees, hypersexuality. It's more about a lack of insight and judgment.
So it's not just about whether they're impulsive, it's about understanding the reasons behind their actions.
Exactly, and that takes careful observation and a deep understanding of the child's overall presentation. And the table also highlights those symptoms that are much more common in bipolar disorder, like we talked about, the decreased need for sleep but no fatigue, those long, intense rage episodes, and even psychotic symptoms.
It seems like those would be hard to miss.
You'd think so, but sometimes they can be subtle or attributed to other things, especially in younger kids who can't always explain what they're experiencing very clearly.
That makes sense. It really shows how important it is to have a trained professional who can put all the pieces together.
Absolutely. And speaking of professionals, the chapter brings up an interesting point about the role of pediatricians in diagnosing and treating mental health conditions in kids. Are often the first ones to see these issues, during checkups or when parents come in with concerns.
But they're not mental health specialists.
Right? And the chapter acknowledges that pediatricians face limitations, a limited time during appointments, the sheer number of patients they see, and the need for specialized training in child and adolescent mental health make it really difficult to provide comprehensive care for these complex conditions.
So pediatricians are important for initial screenings and refers, but for kids with more complicated mental health needs, seeing a specialist is crucial.
That's the key takeaway. It's a team effort with both primary care and mental health specialists working together to make sure these kids get the best care possible.
Okay, so we've covered ADHD, depression, bipolar disorder, anxiety disorders, and we briefly touched on psychotic disorders and autism spectrum disorders. Are there any other conditions the chapter looks at?
Yeah, it also talks about tech disorders, specifically Tourette's syndrome.
Right, those involuntary movements and vocalizations. That must be incredibly tough for kids.
It can be. The tics themselves can be disruptive and embarrassing, and they often lead to unwanted attention or teasing from other kids. But it's important to remember that not all kids with tics need medication.
So when would medication be considered?
Well, for mild cases, behavioral therapies and coping strategies can be really effective. Things like habit reversal training, where kids learn to recognize their tics and develop competing responses, can be helpful. But for more severe cases where the tics are seriously interfering with daily life or causing a lot of distress, medication might be an option.
And what are the main medications used for Tourette's?
The chapter mentions alpha-2 agonists like clonidine or guanfacine as first-line treatments. These were originally developed for high blood pressure, but they've been found to be pretty good at reducing tic severity.
Huh. Interesting. So medications meant for one thing can sometimes have these unexpected benefits for other conditions.
Exactly. And if those don't work or aren't tolerated well, the chapter suggests that antipsychotics, especially the second-generation ones like risperidone or aripiprazole, might be considered.
But antipsychotics are usually used for things like schizophrenia, right?
They are, but they've also shown some benefits for managing tics, although it's important to remember they come with potential side effects, especially metabolic ones like weight gain and changes in blood sugar. Those need to be monitored closely.
Are there any other options they talk about?
Briefly, yeah. They mention that some antidepressants, particularly the ones that increase serotonin levels, like fluoxetine or sertraline, might help in some cases, but the evidence for using them in Tourette's isn't as strong as it is for alpha-2 agonists or antipsychotics.
So again, it comes down to carefully weighing the potential benefits and risks for each individual child?
Absolutely. And working closely with a specialist who has experience treating tic disorders, like a neurologist or a child psychiatrist, is really important. They can make those decisions together with the family.
Going through this chapter, it's becoming more and more clear that child and adolescent psychopharmacology is not a one-size-fits-all approach.
No, not at all. It requires individualized care. You have to consider the child's unique symptoms, their developmental stage, family history, any other conditions they might have. It's about finding that balance between managing symptoms, minimizing risks, and helping these kids live fulfilling lives. And it's a field that's constantly changing with new research coming out all the time. The chapter even acknowledges the limitations of what we know now and stresses how important it is to stay updated on the latest findings.
That's a good reminder for all of us, really, to Stay curious, keep learning, and be open to new information.
Exactly, and to advocate for the best care possible for the kids in our lives.
Before we wrap up part 2, I want to touch on one more important point that the chapter emphasizes.
I'm listening. What is it?
It's the idea that medication, while it can be helpful, is just one piece of the puzzle.
Ah, yes. The medication is not a magic bullet idea. It's something we hear a lot in mental health, and for good reason.
Exactly. The chapter really drives home the point that a truly comprehensive approach to child and adolescent mental health needs a multidisciplinary team.
Absolutely. Therapists, psychiatrists, pediatricians, teachers, school counselors, and of course the child's family, all working together to support the child's well-being.
It takes a village, as they say.
It really does, and it's about creating a supportive, nurturing environment where these young people can thrive, develop coping skills, build resilience. It's about recognizing their strengths, helping them grow their talents, and navigating the challenges they face.
So it's not just about fixing what's wrong, it's about helping these kids really flourish.
Precisely. It's about empowering them to live full and meaningful lives.
This chapter is packed with so much info, and we've only scratched the surface. There's so much more to explore.
There is, and we've covered a lot of ground just in this part. We've talked about the nuances of diagnosis, the roles of different professionals, the importance of a holistic approach, and how this field is always evolving.
I'm ready for the final part. What do you say we move on to part 3 and wrap up our discussion, maybe leave our listeners with some final thoughts to consider?
Sounds good to me. I'm looking forward to tying everything together and offering some concluding insights.
Welcome back to our deep dive. It's the final part of our exploration into child and adolescent psychopharmacology.
It's been a journey for sure, unpacking this complex field.
It has. And I feel like we've peeled back so many layers, everything from those challenges of getting the diagnosis right to the ethics of prescribing meds to young people.
And that crucial piece about a holistic approach, right? It's not just about medication alone. It's about therapy, having a supportive family, creating a space where these kids can actually thrive.
Absolutely. One thing that's been on my mind throughout this whole conversation is the long-term impact of these medications.
Yeah, I hear you. It's a valid concern, and it's something researchers are still trying to figure out. We have a pretty good grasp of the short-term side effects, but when it comes to the long-term effects, it's a bit murkier.
So are we basically going into uncharted territory here?
In some ways, yeah, and that's a conversation clinicians need to be having with parents, openly and honestly.
It's about weighing those potential benefits, like getting symptoms under control, against those unknown risks.
Exactly, and making sure parents have all the information they need so they can make the best choice for their child. It should be a shared decision, a real partnership.
Transparency is so important.
It really is. And of course, ongoing monitoring and reassessment. That's key too. It's not about putting a kid on meds and then just, forgetting about them.
Checking in regularly, seeing how the meds are working, adjusting dosages if needed, watching out for any side effects that pop up.
Exactly, and being open to trying other treatments if the first one isn't working or if the side effects are too much to handle.
It seems like flexibility is key in this field.
Oh, it is. Every kid is different. What works for one might not work for another.
As we're wrapping up this deep dive, I can't help but think about how society views psychopharmacology in kids. It feels like it's a topic that people have really strong opinions about.
Oh, for sure. There's a lot of stigma around mental health conditions, and that can make parents hesitant to even think about medication for their kids.
I can see that. They might worry about their child being labeled, treated differently by their friends or teachers.
Or the fear that meds will somehow change their child's personality, squash their creativity, things like that.
But on the flip side, for some kids, medication can be life-changing, right?
Absolutely. It can help them manage those tough symptoms, do better in school, have stronger relationships at home. It can give them the tools to participate more fully in life.
So it's about striking that balance, recognizing the stigma, while also seeing the potential benefits.
Exactly. And it's about making sure that kids struggling with mental health get the support they need without feeling ashamed or like they're different. We need to create a space of understanding and compassion.
As we close out this deep dive, what are some key takeaways we want to leave our listeners with?
Well, I think it's clear that child and adolescent psychopharmacology is complicated, and it's always changing. There's no one-size-fits-all answer, no quick fix.
It's all about individualized care, really assessing each kid carefully, open communication, and being willing to adjust the treatment plan when you need to.
And remembering that medication is just one tool in the toolbox therapy, a strong family support system, a nurturing environment. Those are all essential parts of a comprehensive approach.
And at the end of the day, it's about empowering these young people to live full and meaningful lives, despite their mental health challenges.
To thrive, not just survive, right?
We hope this deep dive is giving you a good starting point for understanding this really intricate and sometimes challenging topic.
Remember, knowledge is power. The more you know, the better you can advocate for the kids in your life to make sure they get the best possible care.
And to our listeners, if you're feeling a bit overwhelmed by all this information, it's okay. Take it one step at a time. Keep learning, keep asking those questions, and know that you're not alone in this journey.
There's help out there, people who care. Don't be afraid to reach out.
That's a great point. Thanks for walking us through this deep dive. It's been really eye-opening.
My pleasure. And until next time, keep digging deeper, keep those questions coming.